Pharmacist Day theme this year is an opportunity to communicate how pharmacists are transforming health through a variety of health services in their communities, including advising on healthy living, vaccinating to prevent diseases, and ensuring that medicines are taken correctly, thereby managing diseases well and improving quality of life. It also covers how pharmaceutical scientists transform and prolong people's lives by developing safe and effective medicines and vaccines. On the education front, pharmacy educators are transforming outcomes by ensuring that there are enough qualified and competent pharmacists and scientists to meet the growing needs of our society. Dear friend, the facts and figures of Indian pharmaceutical industry will surely make all of us proud. In 1969, Indian pharmaceuticals had a 5% share of market in India and global pharma had a 95% share. By 2020, it was reversed with Indian pharma having almost 85% share and global 15%. Over the last 50 plus years, in terms of both meeting the domestic needs as well as building a leading position in the global pharmaceutical landscape, Indian firms have been successful. India is the largest provider of generic drugs globally. Indian pharmaceutical sector supplies over 50% of the global demand for various vaccines, 40% of the generic demand in the US, and 25% of all medicines in the UK. India enjoys an important position in the global pharmaceutical sector. The country also has large pool of scientists and engineers with the potential to steer the industry ahead to a greater height. Presently, over 80% of the HIV drugs are supplied by Indian pharmaceutical firms. Indian pharmaceutical sector is expected to grow 100 billion US dollar, while medical device market is expected to grow 25 billion US dollar by 2025. Pharmaceutical exports from India stood at 20 billion US dollar in financial year 2020. Pharmaceutical exports include bulk drugs, intermediates, drug formulations, biologicals, Ayush and herbal products, and surgical. India's biotechnology industry comprising biopharmaceutical, bioservices, bioagriculture, bioindustry, and bioinformatics is expected to grow at an average growth rate of around 30% to reach 100 billion US dollar by 2025. India's domestic pharmaceutical market turnover reached rupees 1.4 lakh crore in 2019, which is up by 10%, 9.8%. Dear students, thank you for choosing the right profession for your career path. However, I am having a spiritual philosophy behind it, that God has specifically chosen you to take care of health of others. My advice to you all is be professional, be ethical, and be committed as a pharmacy student and as a future healthcare professional. Once again, I extend my best wishes to all of you on this occasion of World Pharmacist Day. Thanks a lot. Jai Hind.
Thank you so much, sir. Now I call upon Anandita to read the pharmacist oath.
Good morning, everyone. Happy Pharmacist Day to all. Let us take the pharmacist's oath. I swear by the Code of Ethics of Pharmacy Council of India in relation to the community and shall act as an integral part of healthcare team. I shall uphold the laws and standards governing my profession. I shall strive to perfect and enlarge my knowledge to contribute to the advancement of pharmacy and public health. I shall follow the system which I consider best for pharmaceutical care and counseling of patients. I shall endeavor to discover and manufacture drugs of quality to elevate sufferings of humanity. I shall hold in confidence the knowledge gained about the patients in connection with professional practice and never divulge unless compelled to do so by the law. I shall associate with the organizations having their objectives for betterment of the profession of pharmacy and make contribution to carry out the work of those organizations. While I continue to keep this oath inviolated, may it be granted to me to enjoy life and the practice of pharmacy respected by all at all times. Should I trespass and violate this oath, may the reverse be my lot. Thank you.
Thank you.
Thank you, Anandita. Now I would like to call upon Dr. Tapan Pandey, Director Sir of NMIMS Hyderabad campus, to keynote address of this event.
Thank you for this. Thank you, Dr. Pete, for inviting me for this event. This is the first time I'm speaking to students also, pharmacy students on the other side, as well as my colleagues. All of my colleagues, I have met them in Hyderabad, but I can see some of the colleagues are there from Mumbai also who have joined with us. In fact, when I had a small conversation with Dr. Pete a couple of days before, he talked about what kind of role pharmacists actually play in our life. So it's very similar to a Hindu philosophy where you define what is light or what is darkness. So darkness is defined as absence of light. So that's why you have to imagine the world without pharmacists. If you can imagine the world without pharmacists, then only you will realize how important are pharmacists in this world. Because they exist there in this world, our life has been very, very comfortable in that sense. But if you look back to 17th century, 16th century, where so many drug discoveries had not happened, and pandemics like what we are passing through were very frequent. That reminds me about a very famous essayist called Robert Malthus. I don't know how many of you have read about Robert Malthus. So Robert Malthus talked about something called the Malthusian trap. And he said for thousands of years, all the civilizations were at the same stage of poverty. Not many of them were really rich, but almost all of them were very poor because of plague, because of war, because of not good healthcare facilities. So all the world looked very similar, like a communist thinks about that the world is equal, or God thinks that everybody is equal. In the similar way, the world was equal and the world was full of sufferance. But something happened in 16th century and 17th century. A large part of that credit goes to science and discovery of different kinds of drugs. And then the world started changing and people started having a greater life. But sometimes nature reminds you about that part. And the current last 6 months have been that kind of a remembrance by the nature to all of us that you can't take the nature for granted. And whenever it is required, it will come back and teach a lesson to all of you. So that's why I think the celebration of World Pharmaceutical Science Day or World Pharmacy Day is very apt at this point of time, because that reminds all of us about how fortunate we are to live in a world where everything is fine for us, at least appears to fine for us, and we have taken everything for granted, and you always thought that everything is known to us. That is one of the biggest mistake of human civilization, that many a times we wonder that we know everything. But whenever we face a storm, whenever we face an earthquake, or whenever we face a pandemic like COVID-19, we realize how small we are in the process and how the nature is far, far bigger than what we think that we are most powerful one. But one of the best parts of human civilization is adaptability. We are not the strongest animal. We are not the fastest animal. We are not the biggest animal, but we are the most surviving and intelligent animal. And one of the key factors for this factor has been our adaptability. So I'm pretty sure that because of we have resilience, because of we have got this great ability to adapt ourselves, though there may be a temporary loss of life, there may be a temporary loss of the way we have been living our life, but our adaptability will help us to see that what has to be done and how we can survive. So I'm pretty sure that with the help of doctors, scientists, and pharmacists, we are going to have a new normal. And the new normal, everybody will survive and will continue to have a life, but that will be an altered life. It will not be a linear progression of the life that you had so far. Today morning, when I was thinking about when Dr. Petha called me, and I thought, what should I speak to the students? It's fine that I can say hello to all my colleagues in Mumbai, in other parts of the country, and celebrate this part. But what is that I should speak to the students? That is going to guide them how they should look at their profession and career. I think one of the key things for progress of every civilization is that all of us, we were problem solvers, right? We have solved problems. Today also, if you read newspapers, on one side, we have these politicians who talk about what not to be talked about. On the other side, we have got these celebrities who bring us to a dark room and then they show a fantasy to live back for a couple of hours. And then when we come back out of that, we face the reality there. But a large part of the story, if you are following global newspapers and news channels, a large part of the story is about how do we go and solve this pandemic problem, or what are the likely biological warfares which are happening, and how can we go back and look at these dreaded molecules and work against these molecules, or how can we really work on the emerging viruses or bacteria as a fungi and then try to solve a problem there. I speak a bit of a language of science because I'm basically a science grad. I studied physics before doing my MBA. So a bit of your subject I understand in that sense. And a couple of family members being doctors, whenever they sit down in the dinner table and they speak about diseases, I get scared about that part because I don't like diseases being discussed on a dinner table, but still also being curious about life, I try to understand what exactly they are trying to do. So when they talk about intelligent medicines, when they talk about sustained drug release formula, so I try to understand what they are. Being a marketing professor, I try to understand what they are. So that makes me to really get a connection with the student of pharmacy and faculty of pharmacy. I think there are 4 or 5 things that I would like to speak to the students to remember, so that in this grade they change their way they look at the world. When all of us were in 4 or 5 year old in our life, 6 year old, maybe Dr. Pete has forgotten when he was 6 year old. But if you kids can remember back, one of the key things that you find out children when they are 5, 6 year old is they will always ask questions. For everything, they will have a question: why not, what for. I think as you grow up, you go to an education system, and the education system starts giving you answers. But in that process, you stop asking those questions. One of the biggest qualities to be a problem solver is to always keep on asking questions. Whatever comes to your front, there is a causality behind it. With the probability of that causality can be absolute 100% or 70%, but there will be a causality. As a problem solver, you should always look for that part. So you should not stop this mindset where you should go back and ask questions. Start asking these questions always. Always you should go and ask question why or why not, like a small child. If you continue asking, you will have questions about everything of the problem. The challenge is that with a limited capacity of human brain, and if you are focused into one direction, there may be thousands of questions which are unanswered. And who knows, the solution may be in all those thousands of questions which actually we didn't ask. So if you start asking questions for every part of a problem, probably you have to remember that you have to play that role of a small child and always be curious to ask those kind of questions. All your professors who are listening here, they will try to train you and try to make a perfectionist. But my lesson for you is never to become a perfectionist. They may not like this, but you should be always an imperfectionist. For that, when you go back to Puri, I come from Orissa, and you see my Lord Jagannath. No, he is the Lord of the universe, but he is not perfect. He doesn't have legs, he doesn't have hands, he doesn't have eyelids. I don't know how he sleeps. All of us have to close our eyes to sleep, but he also sleeps inside the temple. But without the eyelid, how really he closes his big eyes, I don't know about that. I think it is important for being an imperfectionist. What does that mean? It means that you should have tolerance for ambiguity. No problem in your life is structured, right? Your professors will always say that force is equal to mass into acceleration. So they have a formula, but please remember, they also said that they also tell you something called subject to, right? Sometimes you forget that subject to part, and for your exams, you remember force is equal to mass into acceleration, but you forget the subject to part. Always remember this subject to part. That's important for you as students. Remember the subject to part. Subject to part is the ambiguity part of it. So if you are an imperfectionist, you should always accept the ambiguity. If you accept the ambiguity, then it will make your inquisitive behavior. Then you will be able to do the drug discoveries. I know you'll be into some kind of a profession where you have to Go back, look at the structure of the molecules, composition of the molecules, how they are being combined together, what impact has got immediately over a period of time. So always keep that sense of ambiguity in your profession. I cannot suggest you to keep that ambiguity in your professional personal life, because that's a choice you have to make. But on professional life, you should have some level of ambiguity on that part of it. I'm pretty sure that outside your YouTube, outside your Facebook, you must have seen a bird called dragonfly, a small insect called dragonfly, very cute insect called dragonfly. One of the USP of dragonfly is that it has got more number of eyes. If you look at Disa, who is present now listening to me, Disa has got 2 eyes and she has put 2 glasses in front of these 2 eyes. So we can safely say that she has got 4 eyes, but dragonfly has got multiple eyes. And dragonfly, when he uses the eyes to the same object, he sees different kind of pictures. For example, on one side, he will see blue. On the other side, he may see green. On the front side, he may see that it is red. Human being is the only animal which can identify the combination of colors. But other than that, dragonfly is someone which can see things in different perspectives. So you should be like a dragonfly. So what does that mean? That you should see a problem with multiple lenses. So you should have multiple lenses. So having a dragonfly eye view of the world, it will give you multiple lenses. If you have multiple lenses to the same problem, it is like a vertical divide that you do there. I think your inquisitiveness will be higher and you will always say, why not? Your professors will always tell you this is a fact. But if you have a dragonfly eye as a problem solver, I think pharmacy students have to be more like a problem solver. You'll always say, why not this way of doing it? I'm pretty sure Dr. Pete is very passionate about the labs which he has built there. And lab is something which will give you this kind of experience of to have the opportunity to experiment, right? So the fourth point that I wanted to talk to you is about having that occurrent behavior. You understand what is an occurrent behavior? That happens very often. If it doesn't happen very often, then you call that as a pandemic. I don't know how many of your professors will like if every 2 years something like COVID-19 visits to us. Students will like, because they don't have to come to the classrooms, they can always switch on their Zoom platform or Microsoft Teams, and the professors will assume that you are listening, but you will just run away from that. And in between, the professors have to ping you and identify that part. And it's a very common behavior among students. Being a psychologist, I can tell on that part of it. But you should be always ready for occurrent behavior. Try to read more about what is occurrent behavior. If you understand what is occurrent behavior, you can do relentless experimentation. You'll continue experimenting more and more in that case, because this civilization has progressed because of man's relentlessness towards experiments. He'll always try to experiment on that part. And many times when you walk into your class and your professor is talking to you, is the highest source of knowledge. That's an assumption. But I understand you guys, your generation had challenged that assumption, because you have Google, you'll go back to Google and you will go back and do an experimentation on that part. But this part is for everyone, the teachers present here as well as students, that the smartest guy is outside this conference. The smartest guy is always outside the classroom. That talks about collective intelligence. So never accept that whatever you know or whatever a bunch of people know is the final one in that case. You have to go back and read what collective intelligence is all about. So always remember that the smartest person to solve a problem is outside your classroom, is outside your room, is outside your life, and you need to look for that. So collective intelligence is very important in that case. Collective intelligence helps you to increase the degree of collaborative skills. This is mine, this is not yours, like you have grown up. It should not be like that. When you come together, work together, that will help you to really, really build it up. And the last point, whenever you talk to anything, you should have a story of your own. Storytelling is a very good art to remember that part. Many professors don't do that. They have all facts to talk about. But whenever you are a problem solver, if you are using storytelling to discuss about your problem, that has a larger impact in that case. Now, Ankita must be wondering what is storytelling all about. In every story, you will find out there is something called a character, or there are a number of characters. So for every problem, you will find out there will be characters there. The second part, in every story, you will find out there is a plot. So there is a plot. When you write your reports, experiment reports, it's a plot. What you did first, what you did second, what you did third. That is how it is being done. The third part is a conflict. If all the characters are there and if the plot is being there and there is no conflict, it doesn't become a story for that. So the conflict leads to a problem and you are there to solve this problem. You should have the practice, you should practice this art of showing and telling the idea of storytelling, which will make you to combine all these small blocks which are there, that talks about the characters, that talks about the plots, and that talks about the conflicts, and that talks about a climax. So when hydrogen molecule, oxygen molecule, they come together, they're like characters. But you connect them in different compositions. When you connect them in different compositions, like 2 molecules of hydrogen with an oxygen, and then you take 4 modules of hydrogen with some 10 modules of oxygen and combine that with something else. So these characters, all of these will come into conflict. And you understand that conflict when you go to the highest, the machines that you use in your labs, they burst, they burn sometimes, right? So the conflict will be there between the characters. I'm trying to speak to your language, and there is a climax on the process. A climax can be creation of water, climax can be creation of carbon dioxide, climax can be creation of anything out of that experiment there. But you understand that when you do that, you do under a controlled environment. So there has to be an impeccable story when you are trying to solve your problems. So before I conclude and pass on to whoever is doing the coordination of this part, remember what you have to do. What's the number one thing that you have to do? Number one thing, be a child. Always be curious to ask questions. Why and why not? What is the second thing that you should do? Always be an imperfectionist so that you have a high degree of tolerance towards ambiguity. What's the third thing you should do? You should be like that little bird that I talked about, dragonfly. Look at the problem with multiple lenses. Then you will have a solution for that. What's the fourth thing you should do? Don't say that this is one-time affair and the problem is solved. Always be an occurrent behavior. If you're an occurrent behavior, you are willing to experiment. There may be a number of visits of pandemic like COVID, but you will always have a solution for that. So fourth element is have an occurrent behavior. The fifth one that I talked about, the smart guy is outside. The smart guy who knows more than you is outside your domain. Try to find out this guy and combine the collective intelligence through collaborative skills. If you combine that, you will achieve greater success. Your OBHR professors or manager professors will say team building, but I'm going more than the team building part of it. It talks about collective intelligence. Maybe today afternoon, when you have nothing to do, you can go back and Google about collective intelligence and read about that part. And finally, the last point, show and tell the story. If you have to tell the story, identify the characters, identify the flow, identify the plot, and identify the conflict which is there. As a pharmacy students, if you can do all these 5, 6 things that you have talked about, you'll be having a great character and you will win a lot of laurels for your institute and for yourself. Because happiness is not about money. Happiness is not about the position that you take in life. Happiness is about managing your own expectations. Truthfulness of a person only comes when the person sees himself straight into the mirror. And you know that mirrors never lie. So mirror is the best friend which guides you what you need to do in your life. Thank you all. And I'm hopeful that sometime I'm going to see you on campus. And when we are on campus, we'll have one more conversation in that way. So let me give it back and wishing you all a happy World Pharmacist Day. And personally, I realize, because I have my sisters who are doctors, so I realize how important is a pharmacist in life and how important they are when we are re-looking at our life today, that nature is more powerful than human being. And between this race of the nature, anguish of the nature, and survival of the human being, is the doctors and pharmacists who come in between, and they make our life more safer. They're more safer than Chinese army because the army there is visible, but you are the warriors who are fighting invisible army. Thank you all.
Thank you, sir. Thank you. Thank you, sir.
Thank you, sir. Now,
Thank you, sir, for motivational lecture, sir. Yes,
Mansa.
over to you.
yes, sir. Now I would like to call upon Mr. Syed Mohsin Qadri, sir, to hand over this session.
Wait. Mansa, wait.
Yes, sir.
We have actually break scheduled in between for 15 minutes. Actually, earlier we was in the thought like Syed Mohsin may take some time to join, but fortunately he joined very much early by the starting of the program. So now, if you permit, can we continue with the program?
Sir, please continue with the program, sir.
Sure. So now I request Dr. Rahul Maheshwari to please come and introduce our today's speaker, and we'll continue with the side speech. Yeah, Rahul sir, over to you.
Thank you, Dr. Yele. Am I audible?
Yeah, you are very much audible.
So it's my pleasure to introduce our today's guest, Mr. Syed Mohsin Qadri. Mr. Qadri has completed his master's in pharmacy practice in 2006 from KLES College of Pharmacy, India, and currently he is serving as a pharmacist in Sheikh Khalifa Medical City, Abu Dhabi, from last 6 years, where he is holding many responsibilities, including pharmacist in charge for hemodialysis patients, providing the dose administration aids for non-compliant HD and post-renal transplant patients, medication safety officer for ambulatory care, and preceptor for PGY1 pharmacy residents, ambulatory care, and nephrology. Earlier, he worked as a drug information pharmacist in Karnataka State Pharmacy Council, Bengaluru, India. He also worked as a pharmacist in ambulatory care, tertiary care hospital, and infectious disease unit, UAE. With this word, I invite Mr. Qadri to share his view. Sir, please.
Thank you all for inviting me. As I said, am I audible to you all?
Yes, sir, you are very much audible.
Sir.
Yes, sir.
Yeah. Thank you very much for inviting me, and I'm absolutely excited, delighted, and humbly accepted your invitation to deliver that lecture. And I always find it very challenging and exciting to interact with the students. Just 1 minute. Yeah, 1 minute. I'm sharing my screen.
You are co-host now, sir. You can share your screen.
Yeah. Are you able to see my screen?
Not yet, sir. Not yet.
Not yet. Just 1 minute, please. Just 1 minute. I have to restart the meeting.
He will rejoin back.
Yeah, he's joining soon.
Sir, if he has some issue, then you can ask him to mail you so that you can show also, sir. Santosh, sir.
Okay. Thank you, sir.
If any technical problem.
Yeah,
he
I'll
faces.
contact.
Yeah.
Yeah, can we try once again? Can you please give me the access?
Yeah, just a minute, sir. Sir, you are co-host now. You can share. Yeah, it is visible. Now you can share your screen.
So now my presentation, everyone can see?
Yes.
Yes, sir.
Okay. So apologizing for the technical glitch. So the title of my presentation will be Indian hospitals and where does a pharmacist fit. By the way, by the way, I would like to congratulate you on Happy Pharmacist Day. Am I audible to you all?
Yes, you're audible.
Yes, sir.
Yeah, now my presentation outline will be like ideal pharmacy department structures in the hospital, traditional career options and unexplored career options in Indian hospitals, and how to hone the skills at an individual level, and what are the available resources for this, and how we can move forward from where we are and what we need now at an organizational level. So what will I not be presenting is drug distribution in hospital setup, stock and inventory management, and other traditional roles which are already placed in practice since ages. So we are doing good in those sectors. Now, what is the present status of pharmacists in Indian healthcare and how we are doing apart from industry pharmacists? I will be speaking only about the clinical side or the pharmacy practice profession. According to a World Health Organization report 2007, we have nearly 500,000 pharmacists who are practicing in various settings. Majority of them are in government healthcares and 75% of them are diploma holders. There are some B farms and M farms which are at much higher position in the hospitals. And this large pool of human resource is a service provider of the country. Often they are under-recognized. Now, speaking about what is pharmacy practice, which has three basic components. One is community, hospital pharmacy, and clinical pharmacy. Community pharmacy, I will not be explaining you in detail, or rather I would not touch because there will be many speakers who can speak about this one. But according to my experience, I shall be speaking about some of the hospital pharmacy practice and clinical pharmacy practice. So pharmacy department ideally in the hospital is divided into three sectors like ambulatory care, inpatient pharmacy, and clinical pharmacies. So I practice in ambulatory care pharmacies, and what is the role? Cater the needs of outpatient departments, discharge patients in emergency, plays an important role in medical reconciliation at the transition of care. Now, let me stress what is medication reconciliation, because if the patient is coming to the hospital through emergency or through any admission, there is a transition of care, the patient being from outpatient to inpatients. So this is the step where many physicians or many healthcare professionals can have a fair chance of missing their medications. So for instance, if a patient comes in an unconscious state to the hospital with a chest pain and you never know what's happening and what medication he is taking. The problem in India is even larger because we have many patients who belong to a different set of socioeconomic status and different level of intelligence, different level of cognitive skills, and different level of education background. So many of the patients may not understand their medications even. So this is the step where you miss so many important medications. For instance, if a patient comes to the hospital with a chest pain, and you don't know whether the PCI is done or bypass is done to them, you don't know anything unless the family members come. And whether he is on blood thinners, he is not on blood thinners. So we don't know anything about that. So that is a very important part. And with respect to the physicians, they are excellent in taking medical history. But we as a pharmacist are excellent in taking medication history because we have been trained like that and we think like that. So we have to pull the physicians down. Yes, there are important component like medications, and we need to stress out that one as well. Then when the patients get admitted and then after he is getting discharged, so again, there is a step for transition of care from inpatient to outpatients, where pharmacist can help in understanding his medications. Usually what happens here in India, like for example, if a patient comes to the PHCs and he gets medication, and if he's having normal flu or sore throat, the physician writes the first one is antibiotic and the second one he will write some antipyretics or anti-inflammatory and antihistaminics. So most of the patients here are self-pay. So they pay for their own medications. And in a typical prescription, the most expensive medications most of the times is the essential one. So he goes to the pharmacy and he says that I need 4 tablets of this, 2 tablets of this, because he does not have money. So there we come into picture that we have to effectively counsel the patient to explain the importance of antibiotics. Otherwise, if he fail to take the prescribed regimen, he will end up in getting more sick, and whatever he has invested in physician consultation or labs, that goes down the drain. Now, another important aspect of ambulatory practice is extemporaneous compounding for pediatric, geriatric, and specialized populations. Like for example, this is virtually, non-existent in Indian hospitals. We don't extemporaneous compound the prescriptions. Many pediatric surgery patients, they need so many medications which don't exist in their particular strength, or they are not commercially available. That's how we come into picture. And there is one company called Perigo, which have large volume, large set of solvents which are used and which are studied. But unfortunately, we don't have this concept back in Indian hospital, but slowly it's catching up. So now it comes to the inpatient pharmacy, cater the needs of patients, of admitted patients. Usually what happens here in India, when a patient gets admitted, the physician comes and physician writes the medication, they go down to the pharmacy to bring, and the nurse come and give. We have no concept of IV admixture services. For instance, how to compound the medications, like antibiotic compounding. Like if someone is on amphotericin B for cryptococcal meningitis, it should never be mixed with sodium saline, because it can form precipitates. This knowledge is only a holy cow for pharmacists, but they are underutilized here. And some are like oncology compounding, TPN preparations, and unit dose preparations, and crash carts and anaphylaxis kits, maintenance. This all is the area of a pharmacist, and then most of the area are practiced by the nurses. So nurses, with all due respect, they are overburdened. So we have to take that burden off from them. Now comes the clinical pharmacy practice. Clinical pharmacy practice can be essentially in broader area like internal medicine, or more specified clinical pharmacy practice like critical care, cardiology, nephrology, and so on and so forth. We do have here clinical pharmacists practicing exclusively in critical care, cardiology, nephrology, and solid organ transplant, as our hospital is one of the main transplant centers in UAE. Then there are many committees which pharmacists play an important and pivotal role, being an active committee members, like Antibiotic Stewardship Committee, Pharmacy and Therapeutics Committee, which it involves essentially in formulary management, Institutional Review Boards, Procurement and Medication Safety Committee, and Revenue Cycle Management Committee. As we proceed forward for the presentation, I may explain you individually what's that. Now, clinical pharmacy practice in Indian hospitals, where do we stand? So do we have enough human resource for that? Now, because of Indian advent of degree programs like PharmD and MPharm pharmacy practice back then, there are large pool of people coming out to serve, to cater the needs of hospitals. But sincerely, we need to ask, do they possess the right set of skills? Are they prepared enough to practice independently in more specialized area? Entry level, yes, they are very much capable. But we have to question ourselves, are they very much, because we have Western trained doctors and we have Indian trained pharmacists. So usually they don't go hand in hand, and we need to be more, possess the right set of skills that we will be able to convince our duties and convince for the betterment of patient or pharmaceutical care. Now, as of now, there is no structured specialized training in India for advanced specialty practice. For example, if a physician, if someone is studying MBBS and he wants to be a neurologist, he has to do a MD internal medicine and then DM in neurology. But if some pharmacist wants to practice in exclusively in neurology and neurocritical care, he does not have specialized training. So how we can get such training to be able to adapt ourselves into that set of practice? Now, where to start with? there is a board of pharmaceutical specialties. It's a US-based organization. It's independent organization, and it is one of the most respected organization. It provides the certification course in 13 disciplines, and it is very, very tough. I will share the link later on, and it provides in 13 disciplines to the pharmacy practice to be able to learn from them. Now, there are various disciplines like critical care, oncology, nutrition support, solid organ transplant, nuclear pharmacy, neurology and psychiatry, and internal medicine, which can also give added qualification of cardiology and infectious disease. So there are some of the specialties they provide, and it can be found on internet. Now, BPS board certification, how it is done, exams are conducted twice a year, conducted on Prometric platform. And so far, no exam centers in India. And because no one is appearing, and most of them do not know about that. And the fees is very expensive, like $600 plus $600 for reading material as well. So no coaching centers for exam preparations right now. These are the problems what we have in order to get the certification. Now, both certified Indian pharmacy practice, how many of them are here? So globally, there are over 46,000 board certified clinical pharmacists worldwide in different disciplines. The maximum being in pharmacotherapy, because they give this certification since like more than 15 years, and then least being nuclear pharmacy. Now, how many pharmacists hold certifications in India? Unfortunately, it's none. We don't have, because we don't have coaching centers. We don't have the people who can direct clinical pharmacists to this area. And long back they started in Pune, but that is still dysfunctional, the coaching centers for getting board certified pharmacy practitioners. So what I mean is it a hopeless situation for us if you want to crave for knowledge, if you want to get the skills? Is it a hopeless situation? And I don't think so, because I look it as room for improvement, tremendous improvement. Now, no need. What are the advantages of this our situation? That we need not start from scratch. Already the things are in place. Just we have to harness those things. Learn from others, both mistakes and achievements. What other countries are making the mistakes, we need not do the same mistakes, and we have to acknowledge and appreciate the achievements made by them. Now, some encouraging stories I want to tell. Don't get disheartened. Yes, pharmacists can play an important role, and I want to share some of the stories of at a global panorama, how pharmacists are making significant scopes in pharmacy practice or clinical pharmacy practice. Now, this lady is named as Dr. Judith Jacobi. Now, I must tell you that whenever any Indian doctor or any doctor worldwide, if he is practicing in critical care, he will be honored to be registered and get a fellowship from Society of Critical Care Medicine. We have very few fellows in India, and the fellowship only they give to the people who spends more than a decade in critical care. And this is Dr. Judith Jacobi. She is a pharmacist, and she was the president of Society of Critical Care Medicine, first non-physician to hold that position, and also a dean of American College of Clinical Pharmacy. And then this is the textbook whenever someone is doing a postgraduate in anesthesia or neuro, and some physician practicing in neurocritical care. This is the book what they read, and this is one of the top-notch book in neurocritical care. And its editors are Himanshu Prabhakar, which is the physician in AIIMS, and Zulfikar Ali, which is again the physician in Srinagar Medical College. And one of the chapters are written by none other than pharmacist from University of Virginia. Her name is Dr. Gretchen, and she has more than a few hundreds publication is peer-reviewed journal. So pharmacists are doing fairly very great job, but just we as an Indian pharmacist have to step up our game. Now, clinical pharmacists further references can, if someone wants to practice in clinical pharmacy, they can always refer Society of Critical Care Medicines, and the guidelines are free, absolutely free. And they have especially a clinical pharmacologist section where it caters the need of pharmacists. And then we can learn so much from them. provides fellowship to physicians and as well as pharmacists as well. And BPS, someone can get a board certification in BPS critical care, and also American College of Chest Physicians grant fellowship for pharmacists as well. But it is a 5 years duration experience you need to have, and always a FCCP fellowship fellow has to recommend you. So we need to do a lot of work. We need to do a lot of scope. I mean, there is tremendous scope of improvements, and then that's how you can step up your game. You can hone your skills. And when you possess the right set of skills, the physician definitely will take you seriously, more seriously. And ACCP, that is American College of Clinical Pharmacy, they have many reference book in their bookstores. And if someone is interested to practice in neurocritical care, many bundled resources are available on Neurocritical Care Society. And as I mentioned in my previous slide, Dr. Gretchen is one of the moderator and one of the editor of that section. It does not cost much, but you can always take the bundled courses and it will tremendously help you. Now, if someone wants to practice solid organ transplant pharmacist, personally, I am involved with post-renal transplant patients, the chronic care. And why this subject is very near to me, because many of our patients do their transplant in India, and India is now a hub of solid organ transplant, whether it's heart, liver, and especially Hyderabad is also one of the focal centers for organ transplants. So we have the physicians, one of the most experienced worldwide. We have the surgeons, one of the most experienced worldwide. And they have magical hands, but we still don't have specially trained transplant pharmacists. So how does we do, and before going forward, I want to explain what does a transplant pharmacist role and how he can delineate himself from the other resources. Like medical reconciliation in transition, okay, this is very, very, very important, especially in the transplant. As you all know that transplant patients are mainly on immunosuppressants, and they are more vulnerable for getting an infection. When they are getting infected for any flu, the healthcare professional will take it very, very seriously, because you need to cut down the immunosuppressants in a very balanced way so that it cannot pose a risk of rejection. Plus, it cannot make more vulnerable patient for infection. So that balancing act, a pharmacist can effectively manage. Now, medication therapy management, because once a patient is transplanted and move out of the hospital, at least for 6 months of his post-renal transplant care, he will have around like 12 to 15 medications along with the previous medication. So it's very difficult for him or her to manage his medication. Now, address the side effects of the patient. Some people, the transplant patients, when they go home, they are majority of their drugs are new. So they don't know about the associated side effect. So you need to explain to the patient that yes, you are expecting such side effects, but you need to continue treatment. And if it gets worsened, you have to come back to the clinic. Now, if these steps are not followed clearly, definitely the patient has accelerate the pace of his organ rejection. He has invested a lot of sum of money, and so it's like more than 2.5 million to have one kidney transplant on an average, and all will go down the drain. So, and plus the quality of life is severely affected in a negative way. So the solid organ transplant pharmacist has a very, very important role. But if I am a PharmD newly graduate, and that will be intimidating for me to be in a transplant team, because we start to question ourselves that do we have right set of skills? We don't have residencies here in India now, but yes, we have some resources where we can pull down to hone our skills. Now, discharge counseling also, as I mentioned, it's very, very important, and you have to understand the nuances of chronic care of the graft. Now, how to do skill enhancement. Many references are available for transfer immunology and pharmacotherapy. And from American Transplant Society, there is a course on nephrology core curriculum for pharmacists and as well as the physicians. And it caters everything, whatever we need to have that one. And its fees is not that much. It's only $400. It's an online course and online certificate. Now, Harvard Medical School is also providing course on fundamentals of pharmacology and immunology that will be really helpful in understanding the pathogenesis or the pharmacotherapy of transplant immunology. Now, cardiology pharmacists, because Indian populations have, there is a vast majority will have cardiology issues, and how to hone the skills in this area. If someone is interested, it's a periodic CMEs are conducted from American College of Cardiology and are absolutely free. Then also Heart Failure Society of America provides fellowship to the pharmacists. You need to avail this fellowship to pharmacists, fellowship, you need to spend some years in heart failure clinics. It is very challenging and it's very fruitful to learn so many things about that heart failure. Cardiology patients are easily available. Anyone in our family member will be a cardiac patient. So it's very easy to recognize. And if you possess the right set of skills, you can make their life much, much better. Then many reference books on cardiology are available, which caters the needs of exclusively for pharmacists as well. So, and all the guidelines are available freely over the web. And now one of the important factors is anticoagulations. This is not, the patients don't understand anticoagulation. If someone is on atrial fibrillation, he is on warfarin, and he has to be explained well enough to understand him what is the importance of these medications, or if someone has done a CABG or PCI and comes back to the home and he's on anticoagulation or antiplatelets, clopidogrel, and someone does not explain him or her to take these medication, then there will be thrombus in the there will be clot in his stent, and whatever he has spent so far, the money 1.5 or 2 lakhs, it is completely waste. He will come back to the hospital, and our healthcare system gets overloaded. Our cardiologists, interventional cardiologists get overwhelmed, and it is just because of simple reason that no one explained to the patient what is the medication, what is the importance of antiplatelet medications. Some more resources. American Society of Health System Pharmacists is doing wonderful job. They provide certification of many certifications, like for example, medication reconciliation or pharmacy revenue management, pharmacokinetic certificates, and there are some more like medication safety certificate and emergency medicine pharmacist, nutrition support, and compound sterile preparation certificate for pharmacists. There are some courses which they are likely to announce in this year or the coming year, and because of COVID, they have delayed their announcement for this, like diabetes management certificates and pediatric certificate, anticoagulation certificate, and crisis and pandemic management certificate. So these are coming soon. And there are some of the roles which are not so traditional one. So far I've spoken only about the traditional roles. There are some of the pharmacist roles, not so traditional ones, and you may not even hear so far in the Indian healthcare setup. The thing is, what is pharmacy informatics? Now, this is the perfect amalgamation of pharmacy and as well as the IT. What does it do? Now, according to Health Information and Management System, which is properly known worldwide as HIMSS, it defines as the scientific field that focuses on medication-related data and knowledge within the continuum of healthcare systems, including its acquisitions, storage, analysis, use, and dissemination, in the delivery of optimal medication-related patient care and health outcomes. Now, let me explain you more detailedly. We in our hospital use the system called Cerner. And this is one of the best robust health software what we use in our hospitals, and it is used in Middle East and as well as in United States. And most of the hospitals do use this program. Now, if we have any issues, we call to the call centers to fix the issues, and most of them are addressed in Bangalore. So there are software companies which provide the global IT solutions for this Cerner. So sometimes it makes me understand that being in India, why can't we utilize such information? We have information, we have people, we also work for others, just we need to collaborate this one in our setup. There are 5 core principles for that. One is information management, second is knowledge delivery, and third is data analytics, clinical informatics, and then change of management. I will explain you further this one by one. What is information management? Barcode medication administration. So this is like patient identification. And this is one of the core principles of any JCI or NABH accreditation of hospitals. Now in India, most of our hospitals are NABH and JCI accredited. We use barcode system in labs. So labs won't do without any barcode. Any good lab will have the barcode systems, and even this at a smaller level, at a township level, they have the barcode systems. But unfortunately, we are unable to percolate to the pharmacy. Why? Because we don't have right set of people to do this. And this is very important medication administration, because if some patient is lying unconscious, he cannot tell you the name, only he will be having the wristbands. So for the sample collection or the blood sample collection or any sample collection for laboratory investigation, we follow barcode principles, where we don't use for medication administration, which is equally important. Now computerized physician order entry. I think most of the hospitals do this. They have the computerized physician order. This is very important. Most of the hospital to adapt this because of the illegible handwriting and so on and so forth. And we have many dose, fixed dose combination available, many same brand name, but we entirely different drug. So there are fair chance of medication errors in occurrence if you don't employ this computerized physician order entry. Now, interoperability is like there are various stakeholders in hospitals. So ideal system should have interoperability, which means different discipline can access the same system or same platform to view. For example, if I'm working as a radiologist, I have to integrate my system with the same system what the hospital is employing so as to see whatever the patient notes, labs, medications, and as well as the radiology films, and also the knowledge delivery. So clinical decision support. This is the system should assist the physicians, and a lot of physicians are speaking about this even in India, that we need to have a second opinion from the algorithms or from the artificial intelligence in making our clinical decision. For instance, if some patient is having allergy to penicillin, so he comes to maybe only one doctor know about this, the chronic doctor, but if he is going to someone else in the same hospital or some other discipline in the same hospital, the system should give him alerts that yes, this patient is allergic to penicillin, switch to another antibiotics. So this is only a very small example, but definitely they support in decision making, and as well as this supports in pediatric populations where the doses are calculation based on the weights. Now electronic health records, because a click of the button you can get all the history of a patient, and that is very important for our health information personnel in the hospitals who keep the record keeping. Now data analytics, healthcare analytics, like this is, if you rise one step above, and when you see if you have systems supporting to analyze your healthcare, you can develop the business plan, you can calculate the workload or the disease load on the healthcare setup. Thereby you can get the figures in desirable manner. So likewise, you can analyze and perfect or prepare for pandemics, the situation like pandemics, or if you have some set of populations with more diseases, you can concentrate on those diseases as well. Now resource optimization, yes, because you can control the inventory, you can control the optimization of the medication, you can control the optimization of your resources. That will definitely bring out the cost of the medication, cost of the healthcare, and it will make healthcare more affordable to the patients, and better tracking of inventory. And what are clinical informatics? Computerized medication reconciliation, and repeatedly I'm speaking about this aspect, but this is very important and often under recognized aspect, because whenever the patient gets admitted in hospitals, you can just suspend all the medication in the system, so that whatever the medication goes to the patient, it will be through the physician's information, nurses information, as well as the pharmacist information as well. So one of the informatics also should support the smart pump optimization. We have so many pumps, and these are they are invariably used in critical care. If some patients is hypotensive on inotropes, and how to use the smart pumps, you have to gradually give that one, and system should allow us to calibrate those pumps. The chance of medication error in delivery are absolutely zero if we have the important system and to support this one, and pharmacy informatics can play an important role. Now, there is some other role like medication safety pharmacist. As I said, this is also not very much practiced in our hospitals. Usually, medication error, whenever it's occurred, we start to blame the people or how the system has made error. Usually it is not the system. Many times when we conduct the root cause analysis, this is system based rather than the individual based. So you need to have a proper plans and proper protocol so as to reduce the to increase the medication safety and reduce the chances of occurrence of medication errors. I hope you all remember this case in one of the government hospitals in Hyderabad, that infants were given wrong medication after vaccination. As a usual protocol, they have been they were supposed to give paracetamol, but they have been given tramadol instead. And one child succumbed and 32 were critical. When as per initial investigation, it was found that tramadol was kept in the rack of paracetamol, and no one noticed that one. That's come to pictures of that makes medication safety very paramount. Now, salient features of medication safety is make sure principles of medication safety is practiced, maintain look-alike and sound-alike list and HAM list. And HAM list is high alert medication. And then ensure the process gaps are addressed so as to reduce the chances of errors, analyze the reported errors and conduct a root cause analysis for such errors, and then reduce the corrective actions, and regularly provide the feedback to various stakeholders through publications or newsletters and so on and so forth. Now, let me highlight what is high alert medication list. This is the list when this contains the list of the medications when given in wrong dosage that the effects can be detrimental. One small example I can tell you that whenever a physician writes potassium chloride 20 millimoles in sodium chloride, the patient goes to the pharmacy, bring 2 ampules of potassium chloride, and the nurses take out of the ampule and inject in sodium saline bottle, which is already connected to the patient. Now, the thing is, potassium chloride is a very dense liquid, and it settles at the bottom of the bottle. And initially, the patient will receive only pure, neat potassium chloride, which makes arrhythmia. There have been tremendous and numerous cases which shows the patient died because of cardiac arrhythmia when the nurses injected directly into the ampule. So that comes the role of inpatient pharmacy, which is virtually non-existent in Indian hospitals, that had to be properly mixed, and the bottle has to be allowed to stand for a while and then start the infusion. This is a very small example. There are many examples of this. So now, how to hone the skills if you want to practice only in medication safety? There is a website called there is an Institute of Safe Medication Practices, and it is based in United States and Canada. They award fellowship for the pharmacists, but unfortunately, it's not online, it's on site. You have to go there. But nevertheless, there are many resources available or many publications available from there you can learn. And they also have tools and resources to conduct the gap analysis for your hospital. For example, if I have harm list or LASA list, or according to Institute of Safe Medicine Practices, how I can do where we are, or how we can study our situation. So there are tools. Last year we did our own hospital survey for high alert medications. So according to the criteria or the tool, we were only 70% compliant. 30% we had a chance of improvement, and it was absolutely shocking that we had explored our gaps. Now, there is one more traditional role of antibiotic stewardship pharmacist. So we need this, according to CDC, antibiotic stewardship is the effort to measure and improve how antibiotics are prescribed by clinicians and used by patients. And also improving antibiotics prescribing and use in critical to effectively treat infections, protect patients from harm caused by unnecessary antibiotic use, and combat antibiotic resistance. A country like India, because we have over 1.3 billion populations, and many of the people in the rural setup, they are not registered medical practitioners, and they prescribe indiscriminately antibiotics, and resistance is rampant. And the research and discovery of antibiotics is still not as basically we are running out of antibiotics. Now, how to hone my skills? There is a organization called Society of Infectious Disease Pharmacists. They provide certification for antibiotic stewardship. Besides many resources, there are many publications. With a nominal fee, subscription fee, you can get information to so many things. Various tools for the sustenance of antibiotic stewardship. And now cost is for this certification is only $700, and it's a 12-month course. Now, there is one more research which I am absolutely a fan of, and whenever I am on ward rounds, we definitely use this guide known as sanfordguide.com. Earlier it was in $9, and now they have increased the price for $25. It's an annual based subscriptions, and it gets updated. It is compatible with iOS or all the smart device, iOS or Android or computer or desktop. So they also have some tools which are available to design your own antimicrobial antibiogram. Whenever, if you're working in a hospital, to start with, you need to study what kind of bacteria you're dealing with. And microbiology department will be our savior in this case. So you need to study if someone is having UTI because of E. coli, and 60% of the strains coming to the hospitals are resistant to fluoroquinolones. You need not use fluoroquinolones in such patients. So that's how we have to connect the therapeutics with the pathology or with the microbiology. It holds true for all the organisms, and it will be a boon in critical care. If some patients is having Pseudomonas infection and he is land up in hospital resistant to all antibiotics only with colistin, and colistin is known to have the most nephrotoxic antibiotics. So you need not. So these things help us in clinical decision making to optimize the pharmaceutical care. And now moving forward from here, so we have now so far I spoke about traditional role, non-traditional roles, and some of the websites to hone your skills. But always there is also a responsibility at the organizational level to make a difference to the profession. So what we have and what we do not have so far. So let us discuss what we have. We have organizations like our pharmacy councils, national and respective state pharmacy councils, which can direct us, which can direct the guide the profession in future. And some of the pharmacy councils are doing very great job. Me being an ex-employee of Karnataka State Pharmacy Council, I can completely advocate that organization. They are doing tremendous good job in advancing the profession. And some organizations like Indian Pharmacists Associations and universities and educational institutes play a very important role. I must acknowledge that if I would not have been in KLE, my PG institute, I would not be thinking like this. I was fortunate enough to get into that institution. And physicians are still our surrogate teachers. We don't have enough pool of clinical pharmacists who are practicing in hospitals, as well as they are doing their role as faculty members as well. So still we need to rely on physicians as our surrogate teachers, and definitely they teach you well. But to accustom or to adapt to your needs, definitely you need a clinical pharmacist who also serve as faculty member. Now, what we don't have but should have, an organization both at a national level and regional level which steers the needs of advancing pharmacy practice, especially clinical and hospital pharmacy practice. We have Indian Pharmacy Association, but it caters to need to all the pharmacists, which is a pharmacists belonging to very larger pool or larger spectrum. Now, we also don't have specialized residency training program for PharmD graduates. Now, I don't know when we will see that day, then when educational institutes can vote for this, that we need a specialized training for our PharmD graduates. So such that they can get specialized residency and also be confident enough to practice in more advancing care. Now, how to achieve that? Many organizations provide self-assessment tool to do gap analysis, comparing with your practices with centers of excellence. We need not reinvent the wheel. Always the tools are in place, the people are in place. So we just have to harness and we have to adapt to the situation and then move forward from here. There are some centers of excellence like ASHP. They have tools and how to mark your hospital level with that of the standard practice, and ISMP, as I mentioned, and also ACCP. The American College of Clinical Pharmacy are providing support for international clinical pharmacy centers. And many centers are taking their help, like in Saudi, in Malaysia, Singapore, and Pakistan. But unfortunately, still in India, we don't take the advantage of them. And in American College of Clinical Pharmacy, there is an international pharmacy sections, and the editor is known as Dr. Wafa. She is very, very helpful. If someone, university or the institution, if they can approach, definitely they will help. And also, universities and institutions should explore the possibilities of inducting the advanced pharmacy residencies. Now, local groups can be made with like-minded people at local level for information sharing, because information sharing plays an important role in advancing your skills. As we have seen, as we all are going through the COVID pandemic, and initially when we were given the opportunity to serve the COVID patients, we didn't know what's happening. We were keeping, initially we were told that yes, you need not keep all the patients of anticoagulation. Then it came the autopsy report of already died patients have the clots in their viscera, and with no history of coagulation abnormalities. Then we were told that no, you need to give the DVT prophylaxis. After some time, again it came the change that no, the incidences of clots are more. You need to go full therapeutic anticoagulation, provided with absolutely with the contraindication in mind. So that's how the landscape of the COVID treatment kept on changing. The physician also did not know what to do. The pharmacists did not know what to do. The nurses did not know what to do. So because of the information sharing, there was a dashboard on ASHP website from where we took information for the medication as well as. So this would not have been possible without information sharing. Initially, when COVID pandemic was there, we had hydrochloroquine and so many favipiravir, and now we have much more symptomatic treatment. So this all comes with information sharing, what your experience, what your failures, and what your achievements. Everyone has to share their information. Now, take home message, what we have to do as a pharmacy graduate or practicing pharmacist as well. You have to becoming better clinicians. Like you have to always hone skills. Like if you want to stay afloat in water, you have to wade hands and feet. Likewise, if you want to be at the top of your game, you have to upgrade your skill continuously. What I studied pharmacology, most of the parts is now redundant. So how do we stay in practice? By honing your skills and use the right resources. Learn and teach others. Learn, because I personally don't feel shame in saying that I don't know. That is the first step in acknowledging your shortcomings. That is the first step in the direction of learning. And always don't get disheartened. We hear a lots of things about pharmacy. It's not value. It's not become valued profession, and you don't know, you're half compounder, you're half physician. So don't get disheartened with that. You have to be optimistic. You have to be optimistic about and be confident on your skills. And definitely there are some stakeholders which are on receiving end with your pharmaceutical care skills. And definitely you can also provide tremendous scopes and tremendous improvement in healthcare. And here I finish my discussion, and the topic is held open for discussion. If any questions, please fire at me.
Yes, students, if you have any questions, please go ahead. Thank you, sir. Just to break the ice, that was a wonderful overview of a hospital pharmacist, and it's very rare that we get to hear from a hospital pharmacist. So thank you for that perspective. What I want to ask you is, let us switch back to COVID-19 situation. Uh, so I just want to know, very often we hear this narrative in the TV that now the mortality rates have come down, less people are dying. Is the going down of the mortality rate is because of the virus has become weak, or now we have a better drugs to deal with? What do you think in your
Yeah, yeah, in my opinion, like, now we are dealing with COVID from like initial case report. First case report was back in 1 year before, in September in Europe, China, and then in December in Europe, and started in United States. So initially we were not having any data what we are dealing with. Now, over the years, many autopsy reports have come forward, which give us better overview of COVID-19 pathogenesis, and that's how we are getting adapted to it. This is one reason. Second reason, what I think, mortality is going down globally. Yes, mortality is going down, but as far as India is concerned, why? Let me tell you example why Italy was most affected with. The disease was new, and their Europe life expectancy is it's much higher than India. So the set of the population which were vulnerable was geriatric population, and that's why they have seen so many deaths there. And initially, we didn't, as a healthcare professional, we didn't understand the value of the quarantine. So as the days or the months progressed, we got better understanding, and we started to quarantine ourselves, which is itself as a rate limiting step in the spread of COVID-19. As far as India is concerned, yes, we now have a better understanding. We have lower life expectancy. So the affected population is mostly from younger population, where the prognosis is very, very good. So if someone is on comorbidities, yes, we need to worry, but still we have patients who are on comorbidities are effectively recovered. Just want to highlight this one, but it does not mean that if you are young, you're not vulnerable. Last week, we here in UAE, we started to relax the rules of the quarantine or curfew. And we started last week, we had one admission who was only 30 years old, and he's still lying on ventilator, and he does not have any comorbidity. So we don't know what we are dealing with completely, and what are its further ramifications of individual health on as part of chronic care. Still, we don't know anything about it.
What do you think about the drug arsenal we have now?
No, drug. See, mainly it is symptomatic treatment. Initially, hydroxychloroquine was much in favor, but now it has fallen out of favor. What I am seeing now in many of my relatives also was suffering from COVID-19, but fortunately they all recovered. Remdesivir is rampantly used in India, and tocilizumab, interleukin inhibitor, that has to be judiciously used. Unfortunately, we don't have enough pharmacists to have a watchguard over that, not to use that indiscriminately. And at least rheumatologists or immunologists can play an important role in using the monoclonal antibodies as well.
Yeah. So I think that we are still dealing with something that we don't understand completely. Now we are a little bit more better prepared than in March. So hopefully the mortality rates will go down. And now, this morning when I was coming to Judgel on the bus, I was seeing that the entire Europe is getting ready for the second wave of lockdowns. So I was a little bit worried what is happening, and this is not the way it should be. So maybe So isn't this also the same with UAE? You're also facing the second
wave? Absolutely. Because after April, we stopped our operations in a routine manner. We had completely locked down, and whatever the patients were coming to the hospital, we put them on consultation, and medications were being delivered at their homes. So no patient should visit the hospitals. Only for the labs, but we have certain labs exclusively after COVID screening only they were allowed. As far as our hospital is concerned, we were prepared we still now prepared for second wave. We are expecting that. And most of the beds are like we have done in a hospital as an ICU, because our hospital was focal center of COVID in Abu Dhabi. And we have standby units with all the ventilation and bed. That's how we have to prepare, especially in India, because if what I feel from the data from the curves, the first wave will be overlapped with the second wave in India, because we have a patchy flare up of the COVID-19 in India. Some, like Maharashtra, was the first one to get the first wave, and then started with Karnataka and UP and everything. But now the Maharashtra is dealing and they are prepared for second waves, and still we did not finish our first wave in other states. And you cannot do completely lockdown because it has got economic ramifications. So challenges are tremendous, and first wave and second wave will be overlapping, I feel.
Yeah, I think I would like some students to ask if they have any questions, because hospital pharmacy, among so many pharmacists who have visited our online guest lecture series, I mean, this is the first hospital pharmacist lecture, and I'm sure it will be a lot different from the previous ones. So if you have any questions, please feel free to ask. I mean, Syed and he will try to explain in a most.
Sorry to interrupt, because I got one question from the chats. What is your contribution of role of pharmacist towards a solid organ transplant? Yeah, the thing is, actually we have a dedicated clinical pharmacist also doing that one, but he will be only dealing with the donor selection. So transplant program usually in UAE so far is related living donors. Still related, unrelated living donors we don't have, and cadaveric transplantations are done, but the waiting list is very long, and we still don't have enough laws to support that one, but soon it will happen. Now the thing is, what is my role? I am involved in post admission. I am involved in the chronic care of transplant. If the patient is transplant, most of my patients are transplanted abroad in China and India, and some of them are transplanted with living related donors in UAE. So my role is to make them understand what the medications they are taking, and I have around 54 patients who are non-compliant. Maybe because of many issues, they are geriatric, they are weak cognitive skills. One patient we have post-renal transplant who is schizophrenic, so he is having very difficulty in maintaining his medications. So I have to make sure at every step, even if they take paracetamol, they have to inform me that they are on paracetamol. So if someone is infected with common flu, usually they are directed or they are given appointment to a smaller centers or PHCs, but transplant patients has to come to the transplant team for any sort of infection. And they are the primary care physicians who deal with their aspects. All the other specialties will be are not medical or not primary practitioners. So I should be known if my patient is getting admitted and what's happening with him or her. And I want to share that we have a long duration of graft survival. Some are here with a survival of 13 years or so, and they are doing completely fine.
More questions from students? Maybe I can ask one more question.
Yeah, sure.
So you have really listed a long list of fields. I mean, the most of your talk it was focused on clinical pharmacy, but then again, clinical pharmacy, as you said, it is in its infancy in India. So because most of our students, they are first and second year B.Pharm students, and they are planning to be entrepreneurs in future. At all, they want to bring up a startup in which they would like to create an interface between patients and pharmacists. So what would be those untapped domains within clinical pharmacy which you think can be easily adopted by Indian population? Easily adopted means not too much of a challenge.
Yeah, definitely. There is one what my nephew, my sister's son has already done PharmD, and he's working in Bangalore. He was saying that some physician in Bangalore has opened a consultancy, hiring pharmacists. They have to go to the patient homes and they have to counsel the patients. Okay. So like what I presume that you have MBA graduates, and you must have been listening about Tulsi Pharmacy in Coimbatore. There are 3 pharmacy practice graduates. They opened a pharmacy. and slowly they start to invest more time with the patients in explaining the medications. So slowly over the years, they had a major share of the patients with them. So that's how you do the business. So you can have the case study of that pharmacy, and there is also a Hindustan pharmacy in Goa, which is headed by Mr. Raj Bapna. He's M.Pharm in pharmacology. Even he is doing very great job. I just want to share an anecdote of Dr. Devi Shetty. Everyone knows him in India. He says that the Narayan Hridayalaya, how they can bring the cost down, because they share 11 to 12% of total cardiac surgery market in India. So that's how they can reduce the marketing costs. And he also says that healthcare is not an healthcare unless you make it affordable. So we pharmacists can play a very important role. We can have a startup in explaining the necessity or the importance of medications, but without compromising the relationship between their physician as well as the patients. That is the balancing act you have to make.
Yeah. So looking by that, it looks like patient interaction, the patient interface has already started, and there were some success stories. But there's one more domain that you mentioned in pharmacy, inpatient pharmacy, especially critical care in pharmacy. So that is mostly done by nurses. But then, is there any way how a pharmacist in India can actually participate in such an activity? Because do they require any special permissions for PCI or any certification?
Yeah, I think, actually, the documents what we follow in inpatient pharmacy is USP 797, and the most recent is USP 800. So the hospitals, they are freelance, many consultants available, but unfortunately, in India, there are no consultants for that. One, I know the consultant, he is in United States. His name is Mr. Eric Castango. He's one of the best consultants, and they can help with their experience in establishing clinical pharmacy. Unfortunately, the hospital administrators understands the language of money. So if you want to sell your services, you have to give them economically viable option. And the first thing which can come to you is that why I need to pay for inpatient pharmacy setup while all that work is done by the nurses. So why they need to invest in pharmacies? That is the first questions we will be having. So we need to understand or look up what are the errors that can happen. One of my friend was working in Bangalore Institute of Oncology, and they were not having any oncology preparations back then. Now they have. So they started to analyze the urine samples of the nurses who were administering the oncology preparation at the bedside, and they found the traces of chlorambucil, which is itself is an oncology. So that's why that is a risky behavior. Whenever an oncology medications is prepared, it is in a negative pressure room because the vials have filled in a positive pressure to handle the cold storage or the 25-degree storage. When you puncture those vials, the fumes comes out and it seeps through skin and exposed skin. So this is the area where you can challenge them, and you don't need a very expensive. You need to have the pharmacists who are trained in oncology, number one. Second, you should be able to tell the hospital administrator in terms of language of money and quality of life. If you nail these two challenges, then is no stopping ahead. Once only one aspect is open, it starts to open channels for other hospitals and as well as other services in the hospital.
Others will follow this. Any more questions from students? I would love to see students. Dr. Peter wants to ask.
Ashwin sir, if you permit me, then I'm.
Yes, sir. Please go ahead.
Thank you very much, Mr. Mohsin, for giving us a wonderful overview of the hospital pharmacy operations in UAE. In this corona crisis, where majority of the beds in the hospitals are occupied by the COVID-19 patient, how you are managing the other patients, critical patients, especially the inpatient?
Yeah, the thing is, we have like 3 tertiary care hospitals here, sir. under the umbrella of same parent organization. We all work for that organization. So all the non-critical areas where non-critical patients were sent to some PHCs or primary health centers, who did not likely to be admitted in the hospitals. Elective surgeries were postponed. And then some of the essential surgeries were shifted to other hospitals. Our hospitals were only reserved for COVID patients. Initially, we thought that all the patients need to be admitted. So we very easily, our beds got overwhelmed. So after that, we thought that not all the patients need hospital admissions and not all require ventilators. So we need to empty those beds. So we had prepared, and thanks to the authorities here and also the administrators and also the government, which constructed the field hospitals which can accommodate few thousands of patients. They were quarantined there. And then it needs the budgeting also. And then our hospital were only kept for the highly sensitive level 3 critical care patients. And we didn't have enough healthcare professionals to address them. Only nurses and some of the respiratory technician and anesthesiologists were given direct access to the patient care. Rest of the physicians, pharmacists, and even I was also involved in COVID-19 patients, they were not given access to the wards because you need to wear the PPI and unnecessary, you're exposing your staff to COVID-19. We used to do our consultations online, teleconsultation. So that's how and we, all the healthcare professionals were given set protocols authorized by the authorities, and according to those standardized protocols, we started to treat. We had ophthalmologists treating COVID patients, we had surgeons treating COVID patients, we had dermatologists treating COVID-19 patients, because they were giving a certain set of this one, and whenever they have hiccups in managing their therapy, we were given the green light to consult the hematologists on board. They were 24/7 on call for the coagulation profiles and as well as the respiratory physicians as well. So like that, we started to manage. And in the field hospitals, there are only internal medicine people or medical practitioners or interns used to handle everything under the supervisions of only few consultations. They were most likely stable patients, and they were given guidelines that whenever the patient shows these signs, they have to redirect to the hospitals. And case management also will take an important role in this, in making sure by the time the patient comes, the bed is free for him.
Thank you, Mohsin.
Mohsin,
I have a question if you permit.
Yes, now please go on.
So very informative session, Mr. Kadri. You mentioned about clinical decision support. So in context, if you brief our students about how important to gain the technical knowledge and understanding of key concepts in pharmacy.
Yeah, I'll tell you two examples here. Like, for example, if we all know that methotrexate is a high alert medication, right? So methotrexate, what happens if it is practiced for rheumatoid arthritis, it is given every week. But if it is practiced in oncology, it is given every day with a certain set of cycles, right? So if a patient comes for ambulatory care, and if a physician wants to order, if an ambulatory patient of rheumatoid arthritis takes daily methotrexate, it is lethal. So for instance, if some physician comes to, some patient comes to outpatient specialty clinic, and the physician wants to write an order of methotrexate, and by mistake he is ordering every day, the system will not allow him to do that. System will give alert that this is an ambulatory patient with no oncologic history, and he has to be given every week, not daily. This is one, and vice versa holds true for the chemotherapy patients who come to receive their chemo sessions. Even in that case, if the physician wants to order once weekly, he will not be able to order that one. Most of the times the physicians can be same, but still the system won't allow them to have that's how the system plays an important role. This is one example. Second example, with the transplant, post-renal transplant function, so newly transplanted kidney, the GFR does not rise very quickly. It needs few weeks to function at 80% of the original capacity. So the discharged patients for 6 months for CMV prophylaxis, they are given valganciclovir. So usual dose of CMV prophylaxis for valganciclovir is 900 milligram. But if the patient is not having creatinine in clearance, you will end up in damaging his new graft. So the system will allow that his creatinine clearance is less. So you need to recalibrate the dosing. So that's how the physician will have a second thought to recalibrate his dosing. And also it also play a clinical decision support in making in pediatric and geriatric patients, or also in TB patients. So TB patients, whenever they come to hospital, it's a weight-based dosing and they have lack of appetite history. So once that they get the treatment 1 or 2 months, it improves their appetite and it changes their weight. So you need to again readjust the dosing, So these are the few examples where the system helps in clinical decision making for us.
Thank you. Thank you.
More questions? If there are not many more questions, one last question I would like to ask Syed. I asked this question with everyone who is connecting with us from abroad. So the same question goes to you as well. So do you see, is there a silver line for Indian system of pharmacy? Because we have seen pharmacists from all over the world coming out here and talking to them and ask the same question. You have settled outside India for long. You have seen, you're already acquainted with the Indian system and also seen the system out there. So मेरा प्रश्न है कि have you seen, is there any silver lining for Indian system? Is there any ways Indian system is better than the one in the Western system of healthcare? Because yeah, there are certain points. I just want to see how you assess the situation. Is there any silver lining for Indian system?
Yeah, absolutely. There is a silver lining. The reason why, because for instance, at an organization level, there is much more to do, but it is not in our hands because it should be a collective effort. But what we can do here, as an individual levels, you have to be confident enough to speak in front of physicians. For instance, if I'm newly graduate PharmD student and a consultant, he is practicing like more than my age, will not listen to you. Because he initially, when medicine is practiced, it's an science, but as you get experience, it will become an art. So and I completely agree with that. And it will be overwhelming and intimidating for the pharmacy graduates to go and in front of to doctors. But there are some holy cows and holy grail for our survival, and which only we have that one. For example, therapeutic drug monitoring, it is our holy cow, and we are the only one who are expert in this. And in clinical chemistry, we always have an edge over clinical chemistry. No matter how much the physician knows, only some physician know about clinical chemistry to some extent is a nephrologist. Apart from nephrologist, no one knows. So when you speak about, when you amalgamate your knowledge of pharmaceutics in clinical practice, they lay down their skills. They definitely they will listen to you. Once you start maintaining or starts making them accept yourself in their area, in their domain, they will start you will open channels for many others. But yes, organizational levels, yes, we need to do a lot more. I will tell you one example of my own experience when I was doing my MPharm. I was the first one to be posted in nephrology there with Dr. Anand Narayan Malu, and initially when I went there, I was not treated well, to be honest. But by the time I finished my dissertation in dialysis, I was the one who was adjusting the dose and everything. And MD graduates supported me well at that time. And to this day, our friendship lasts, and we do speak with them, and it's over like 16 years, and still I speak to them on regular basis. So that's how you can bridge the gap. That's how you can improve your face value in view of medical profession.
So sorry, I guess they just got disconnected. There's a power cut. They'll be back.
All right.
So Manaswini, you can continue speaking about all of you till he comes back, so that we don't see each other's face only.
Okay,
You
sir.
are the MC for the event, you know. And Subham just woke up. Just now Subham woke up. I can see him half dozed.
Not actually, sir.
Yes, Manaswini, I'm just wondering
sir.
how come you don't have. I'm just wondering how come you people don't have any questions to Mr. Mohsin. He gave a very good presentation and he spoke about something really up to date on pharmacist's life. I don't know whether all these things are included in your course or not. If they're not part of the course, people should go and read it from other sources that he was referring about, so that you are update on this subject. Sometimes the practice in the industry and what we teach, there is a large gap between them. So now Dr. Pete has come back. So Manaswini, I'll take away some credit from you for keeping you engaged. So Dr. Pete, it is up to you now.
Sorry, sir.
Yeah, thank you, sir. Yes, Lakshmi, sir. Yeah.
Yeah, there was a power break on our side. So, Sahil, yeah, can you hear me?
Yeah, I'm listening.
Yeah, so I'm glad that there are certain definitely niche areas where we can really rule and make inroads into the profession, and along the way we can take the profession forward. So apart from that, anything else you saw in terms of the affordability or in terms of the medicine affordability? I saw that that's a big problem over there.
Yeah, definitely, because most of our patients are insurance-based patients. You know, so the insurance pay us. That's how we get our salaries from. But medications are very expensive, and this is the area where I feel fortunate. In India, we have many cheaper options available. And here just even a simple flu can cost you around not lesser than 500 dirhams, which will be equivalent to 10,000 rupees. You know, so within 500 rupees we can get that treatment. But on the flip side, we don't have enough set of population who can even afford medications at such a minuscule level. You know, so that's definitely a challenge for that. And to make our pharmaceutical industry sustainable, we need to keep some cost to the medications. So there are some hidden costs which we can tailor it. For instance, most of the time, the patients land up in the hospital, and one of the major component of this is medication non-compliance. Because medication non-compliance will make you more sick. I will tell you one example of my personal experience. I belong to a farming family, and I stay in a very small village in India. We do farming there. So one of the lady from my village, she was having osteoarthritis, and she was visiting so many physicians, and so many physicians gave her non-steroidal anti-inflammatory agents, and the colors were different, the packages were different, and she ended up in taking all of them from years together and failed her kidney. Unfortunately, she passed away because of this. That was only a simple intervention. If any pharmacist or any physicians would have paid an attention to explain her that these all do the same effect, she do not lose her kidneys. So this problem is very huge, and we as a pharmacist are specifically trained for this, and we need to explain to the patients. And you don't need advanced skills for that. With whatever you have been taught in a college, you can still start practicing. But to open a startup like patient counseling services, I am not aware of any legal implications what we are getting. And definitely, if you have some, then you will have a resistance, and that's how make it interesting. If you don't have resistance, there is no point in taking the challenges, you know. And Not only you can start with your family itself, you can play a very, very important role by explaining to the people about their medications.
Yeah, resistance nahi hai to maza nahi aayega. Yeah, that was wonderful interaction with you, Syed. I think we have already reached once.
Sir.
Yeah, is there any other one?
Yes, sir. I have a question.
Yeah, please go ahead.
It's just out of curiosity. Very good afternoon, Mr. Syed Mohsin. I wanted to know, are there any, I mean, in such cases of mishaps and are there any regulatory consequences or regulatory involved in the hospital pharmacy, like auditing?
Yeah, absolutely. Because as one of my role is like I'm serving as medication safety officer, and I do root cause analysis for any medication error occurred. Most of when you analyze most of the medication error, what we happens, we are not prone. We are also prone for medication errors, and most of them are wrong dosages, and some are look alike and sound alike. Fortunately, we didn't have any sentinel events like which resulted in permanent damage to the patients or something like that. But yes, when we identify, first of all, you should stop blaming the people because of the sense of blame. They don't report. So that has to be the environment in the hospital or whatever the organization you're working in, that individuals will not be blamed. And when we do root cause analysis, most of the time, it is a system issue. Not an individual issue. So once the medication error is escaped at every level, it ends up in actual error. So near miss events have to be reported and studied. So once you study for a larger period of time, you will see a trend. So when you observe a trend, you will see how to address those gaps. That's how you can come developmental plan. So now I will tell you one small example with a few days back. One of the nephrologists, transplant nephrologist, he called and he said me that this is the patient. He is not on Imuran, which is azathioprine, and some of your pharmacists told me that he is on Imuran. So when I checked Imuran, when I confronted her, did you speak to this nephrologist saying that the patient is on Imuran? She said, no, I did not say Imuran. I said Neoral. Neoral is cyclosporin. Okay, and the patient was on cyclosporin. Why it happened? Because in the COVID situations, we were on masks and our voice got muffled on the phone. Okay, so that's how the errors can happen. And it would have been detrimental error if that was happening. So I then called that, yes, it is because the voice was muffled. And when we started an investigation for that, and the voice was muffled, and then the patient was, the pharmacist was saying Neural, not the Imuran. Then we started to tell that Imuran, if you want any verbal instructions will be stopped. Only verbal instructions are permitted to discontinue the drug in case of crisis. So any verbal instructions we don't accept from physicians.
Yeah, I think there is one question from Vedavati. As you mentioned, there is a change in today's pharmacy learning than what you had. Why do you think that there is a need of this? Because after all, it contributes into learning. And if the changes are made, then how to cope up with them and keep us updated? I think if Vedavati is live, she can activate her mic and she can ask, clarify her actual question.
Vedvati, you can unmute yourself and ask the question.
Yeah, Vedvati. Okay, maybe network issues.
I think loosely I understood what she meant to say, that why there is a need to keep you updated, right? There is a small story when we used to read when in the school that if a man wants to axe a tree, how would he spend his time? So if and he told that it took me 6 hours to chop this tree off. So how do you bifurcate your timing in doing. So he said that 5 hours I will spend in sharpening my axe and 1 hour in cutting the tree. So it seemed like that if you want to stay at the top of your game, you need to learn always. And more importantly, because medical profession is in ever transition. Now we are moving towards more specialized medicine or specific medication known as pharmacogenomics. So still we don't have enough pool which have interest or which have set of skills in pharmacogenomics. So you need to forecast your role and how you have to be yourself prepared for that upcoming role. That's how you take challenges and update yourself. If you want to swim and stay afloat, you need to move your hands and feet. Otherwise, you will sink.
I hope that answers with this query. I think we're running short of time. I think we will end here.
Sir.
Yes, sir.
So before closing this session, we have the prize distribution ceremony.
Okay.
Yeah. So in presence of our guest speaker and the director sir and Anil sir. So may I proceed for the prize distribution, sir?
Please go ahead.
Let me share my screen and share with you all what actually happened for last 2 days. Sir, can you see my screen?
Yes, sir.
Yeah. Sir, Saeed sir, Tapan sir, and Anil sir, we had this event a week before announced as a name play bill for Pharmacy Thrill. That include our team members from the second year, Team Udan, Vedwati and Mansa. They were dealing all these activities along with the students of their classes, second year and first year class. We had near about 71 participants who they registered for this play pill activity. Out of this, 48 participants, they were able to start with their Zoom enrollment, and we had first round with the 48 participants. And the first round was a pictorica in which koalas was provided to all the participants, and out of that koalas, they need to find out minimum 15 images related to pharmacy and medicine. So in this round, the 30 participants could able to reach the round second. Okay, and that was limited for the 90 seconds. So you have to find out 15 images in the 90 seconds. So that task can be that task was completed by 30 participants to reach into the round second. Round second was a kind of riddles, 15 riddles, and they have to complete all the riddles within 7 minutes of time. The riddle were very interesting, and out of the 30 participants, only 11 participants could able to enter into the round 3. So finally, we got 11 participants to complete the poster. So these were the 11 participants who could able to complete the riddle with their scores. Okay, this is a direct snapshot from the Google form. So these were the 11 participants who they are entered in the third round. So let me take you through the poster presented by these 11 candidates. This is the first poster. I'm not yet declared the winners. These are the posters submitted to the assessment. So this is our first winner, first runner-up. We declared Budavan Sanjivani as a third winner. Okay, placed in the 3rd position. So congratulations, Sanjivani, if you are there in the Zoom room. So you are declared as winner at 3rd position. This is the handmade poster on the theme Pharmacist More Than COVID Warrior. Congratulations, Sanjivani. So please, now I request all the dignitaries in the room, please hand over virtually the certificate to the Sanjivani. Certificate is right here. Sanjivani, are you there in the room? I think Sanjivani is not here. Let's go with the next poster.
Sir, she is there if I'm not wrong.
Sanjivani, are you here? If you are
He
here,
has
please.
to unmute.
Yeah, unmute and switch on your video. So, sir, please virtually hand over the certificate to Sanjivani.
So I request Syed sir to virtually hand over this certificate to our second runner-up, Miss Sanjivani. Syed sir.
Yeah, Syed sir, you just virtually declare that this certificate is presented to Sanjivani.
Yeah. This is the certificate of achievement which is present to Sanjeevni for achieving 3rd position in Playpill. Many congratulations.
Thank you, Syed sir.
Congratulations, Sanjivani.
Sanjivani. This is our second winner. Yavalkar Akanksha. Second runner-up. So now I request Tapan sir, please hand over this certificate to Akanksha for achieving 2nd position in the Playpill, a game-based poster making competition. Akanksha, if you are here in the room, please.
She's here.
Accept. Yeah. So should I go to the 3rd one? The first winner?
Yes, sir. Yes, sir.
Yeah. Yeah, this is the first poster made by Sathe Komal from the Parikrama Institute of Pharmacy. Komal, are you there in the room?
Yes, sir.
Yes. Anisa, please hand over the certificate to Komal.
RTS Congress certificate, Komal. So I am pleased to announce the first prize, the Playpill, the winner of this competition, Miss Sathe Komal. RTS congratulations, Komal.
Thank you, sir.
Yeah, all the winners are requested to submit their bank details. Okay, first
that is
scan
very
copy,
important.
scan copy of your passbook. Scan copy of your passbook because your ID cards are already with us. So as we can deposit your amount of price to your account within next 15 days. So congratulations to all the winners and participants. And one good news for all the participants, all you are going to receive certificate of participation, certificate of appreciation. All the 11 participants who they have submitted their poster to the competition. Thank you very much, sir. And I rest the room. Yeah, sir, I think event is completed now.
Lakshman sir,
If you have any closing remark.
Yeah, you will be giving closing remarks. Yes, Lakshman sir.
Yeah, thank you, Santosh sir, for giving me the opportunity to express gratitude to everyone who made this a meaningful event and a time well spent. At the outset, I would like to thank our guest speaker, Mr. Syed Kadri, a very good friend of mine who gracefully agreed to share his message as well as his perspective as a hospital pharmacist. And your presentation has left us inspired, Syed. And I mean, there are plenty of other things to think about, and I'm sure time is less, but definitely in future, whenever there is an opportunity, we'll get back again and talk more about it. And I have to also thank Mark Zuckerberg for keeping me in touch with Syed for the past 15 years. I mean, we know each other on Facebook, but then again, this is the Pharmacist Day that allowed me to connect with him, and he gracefully agreed for that. Thank you, Mark Zuckerberg, and also Sir, thank you very much.
Thank you very much. Thank you very much for finding me worthy enough to give you a lecture. Thank you very much. I'm absolutely thrilled and honored, and definitely I am learning so many things from you all.
Yeah, thank you, sir. And also we should take this opportunity to thank our director, Dr. Tapan Kumar Panda, who addressed our students for the first time. Sir, your message on troubleshooting, problem-solving apparatus, your analogy of a dragonfly, and I'm sure there are plenty of other things you want to share. But then again, we are definitely looking forward to interact with you more times in future. Thank you very much for giving your address, Tapan sir. And I would like to also take this opportunity to thank Dr. Anil Pete, who has updated us with regard to the Indian pharmaceutical industry and their numbers. It certainly reassures us that we would be able to take over or take up this COVID-19 pandemic that it has thrown. And the whole world is looking up to us, to IP industry, Indian pharmaceutical industry, to see to it that we are on that side of the pandemic. All right. And also I would like to thank other faculty members from other schools, Dr. Sila Ramsundar and others, our own faculty who have been with us throughout the entire event. Thank you very much. Also, I would like to thank all the participants who joined us from all the corners of the India. And also I would like to congratulate the winners of the competition. And your joyful presence surely uplifted the pace of this event. Finally, I would like to thank our leadership of SPTM, Gaud sir and Bala madam, and also our management for supporting this event. Finally, last but not the least, I would like to congratulate and also thank all the team members of Team Udan, and also Santosh sir for nicely organizing and meticulously planning everything. Of course, there were certain technical glitches, but then we have successfully concluded it. Thank you very much for joining with us, and wishing you all the best. Wish you all a happy Pharmacist Day, and have a great day, all of you. Thank you, sir. Thank you.
So should I close the meeting? Yeah, yes, sir.
Yes, sir.
Okay. Thank you all.
Thank you all.
Thank you, sir.
Thank you, sir.
Thank you so much, sir.
Thank you very much for
Congratulations.
Thank
you, sir.
of this event.